Well, hello there. Welcome or welcome back. My name is Julie, and this is my journal, specifically my health journal. And I'm lying here resting. Today is a day of just complete rest. Just rest. And in fact, my kitty, where is Kitty? There's Kitty. Kitty is also resting. Hey, preciosa! She has been taking such good care of me. So yesterday was quite the day. I got injections again in this elbow and in that tear below the elbow. And the process of it was not nearly as awful as I was preparing myself for, because last time we did it was pretty dang bad. But this time I was actually able to converse during the procedure, and that was wonderful. Shortly thereafter, though, of course, the pain really kicked in and was rough. I was on pain medicine through last night, but I now haven't had any this morning, and it's almost 11 a.m. Hopeful that by resting it, not using it, that I won't have to take any of that today. Really hopeful, because you guys know I don't like to take that stuff, most especially because it messes with my guts, my digestive system. So anyhow, that was great. Got that done. But also the day before, I had called finally to set up the pelvic floor therapy, knowing that it was probably going to be quite a wait. I wanted to, get on it. And as I'm on the phone with the receptionist, this was so awesome. She was, looking at her computer schedule thing, and someone called in to one of the other receptionists and had canceled their appointment, and I was able to grab it right away, and that was for yesterday afternoon. Couldn't believe it. Oh, I was so happy and terrified and nervous, but grateful. So pelvic floor therapy is exactly what it sounds like. It's your pelvic floor. So down where your tailbone and your vagina and all those other fabulous, beautiful things, they're all down in there. And where my tailbone got pushed out during childbirth, which actually happens to a lot of people. A lot of them realize it quite a bit sooner than I did, but we're 12 years out from childbirth. So it might take a little more work than for some other people, but so grateful I was able to get in for that appointment. And since I was on pain meds, my daughter drove me, which is wonderful. So grateful she had the day off. So she drove me to it, and I was incredibly nervous because, they go right up the butt. They got to get access. They can access vaginally some areas, but not the tailbone. And I was of the mind, if we're going to do this, let's just do this. I want to do whatever is absolutely most effective. I had already psyched myself up, prepared myself for it being just awful. And so I said, well, because, they give you these other options, because some people just really don't want to do that, and which I absolutely understand. I don't want to do that either, but you get to a point of desperation where you just want to fix the situation, and where the injection I had the other week under fluoroscopy has still not done anything for me. They say give it up to 4 weeks. That's fine, but it, getting desperate when you can't even sit for 5 minutes without it just being awful. So anyway, I'm like, no, you just get right up in there and let's do this. And so the physical therapist, can I just say, she was an absolute treasure. Plus she had tiny fingers, so that helped. Look, this is my journal, okay? And you guys know here, there's no filter, there's no censor. And yes, I'm sharing some very personal things here, but if it can help even one other person to avoid just being lost in the jungle of healthcare, then it's worth it to me. Plus, it's a good place for me to vent and laugh and all of that. Anyway, she was absolutely a treasure. So kind, so compassionate, so patient, wonderful bedside manner, and, talks you through the whole thing and is encouraging and straightforward. Now, when they do the exam and procedure, of manipulation and, when I say manipulation, I mean like manipulating the tailbone and the muscles inside and stuff like that. They do have essentially a chaperone. They have another professional in the room during that part of the visit, which I think is wonderful. That helps everybody to avoid any shenanigans. And it so happened that the chaperone that came in was named Raquel, which is my sister's name. And it was like, oh, that just made it that much better for a situation that was uncomfortable and awkward and all of those things. That helped, So anyhow, they have you take your shoes off, undress from the bottom down, and then you lie on a table bed thing and on your side with a sheet draped over for privacy. And then those two ladies came back in, and the practitioner will wear a glove and use lubrication, which you'll appreciate. And I was surprised by this, you bear down similar to childbirth, like exactly like childbirth, or like, having a bowel movement, which will help relax and open up the rectum, the back door, so that they can more easily get into the tailbone. And literally, she moves the tailbone very slowly, and you breathe through it and all of this, but the idea is to mobilize, is what she said, mobilize the tailbone, get it to loosen up. And then from there, going around to each of the kind of muscle groups or sections in the pelvic floor, and applying pressure to different trigger points to help them relax and loosen up and all of that. And talking to you, connecting with you throughout to make sure that you're comfortable, so that you know exactly what's happening, to have your permission to do it. Like almost every movement, she would ask my permission, which I thought was wonderful. I know a lot of that has got to be, legally required and stuff, of course, but it's also to make you feel comfortable, because it could feel violating. I'm absolutely certain of that. It's a tricky situation. Okay. And having the communication and continually asking, is this okay? Is that okay? All of that is helpful, very helpful. So anyway, manipulating the tailbone to mobilize it, like I said, and then working on those muscles. And we found that the right side of muscles was significantly more tender and tight, which honestly makes sense, because that's where I have that's where I have the sciatic pain, which could just be super tight muscle pain, but we don't know for sure yet. Anyhow, obviously that right side is just really tight, inside, outside, all of it. And so we did that session, and then you get cleaned up and dressed and all of that, and then talk again and go over different exercises and stretches. And I think she gave me 4 exercises and stretches to do that I'll be doing along with the physical therapy that I'm already doing, the regular physical therapy, with some modifications while my elbow heals. But anyhow, it was interesting. Would I want to do that every day? Nope. But I did feel Like after the session, I went to sit down while we discussed the exercises, and there wasn't immediate pain sitting, which for the past at least month, just sitting down immediately is painful. And it wasn't, which tells me we're doing something right. Now, this morning, I'm incredibly sore, because we're talking about muscles and tailbone and tissues and stuff that got messed up 12 years ago and have healed, quote unquote. They've adapted over 12 years and gotten kind of stuck in place in a manner that they shouldn't be. And so forcing them even gently out of that position, well, yeah, it's your body's going to respond. And I am quite sore this morning. So between that and having had the elbow wet needled with ultrasound yesterday, yeah, my body, my mind, everything is very, and I've even had coffee, but yeah. So I am really hopeful and interested to see how I feel when the soreness has worn off, when I'm not needing the ice, to see how it feels to sit. I'm going to wait till this afternoon to start on the exercises and stretches because like I said, I woke up quite sore and I don't want to, because I have no strength in the, I have no strength. But it's worth it. It's worth it. And we have been making a lot of progress in my elbow. Well, both elbows. The one is now to maintenance, and the one we worked on yesterday, there is significant improvement as well. So yeah, I don't think it's going to take as long as I thought it was for this tear that we found. I don't think it's going to take as long as the elbows did to progress and to get to maintenance, because it's a different animal. It's a tear below the elbow, and so it can heal more quickly than the elbow because the elbow's in constant use, whereas this tear is below it. And based on what we saw in the ultrasound, is more quickly responsive than the elbows. So that's exciting. So lots of good things happening. But unfortunately, a lot of times has been my experience, that I've got to fight pain with pain, got to fight chronic pain with temporary pain, and I'm absolutely of the mind that it's worth it. And I'm grateful to be in a position and situation where I'm able to pursue these courses of treatment with a husband that supports me and family that helps and all of it. And being able to be, here on YouTube and being able to document the journey, but also, make a few bucks along the way, which helps support the whole situation. Because I don't know if you know, but healthcare in America is incredibly expensive, even with good insurance. So, we're doing this, and I'm so grateful. And how amazing that I was able to get that appointment, because if I hadn't have gotten that canceled appointment, they were booked out, I think 6 weeks. 6 weeks. So I got incredibly lucky. So incredibly lucky, and lucky that my Olivia had the day off. And so she was able to drive me to my appointments, and she's wonderful. She's just wonderful. And I've just got so many wonderful people in my corner, including you. Thank you for watching this. Thank you for being part of this journey. I do want to do what I'm able to, which is not right now. Right now, all I can do is unedited journaling. So a quick shout out to our Patreon producer, Heather Roberson. Since I'm not going to be editing this, I won't be able to put her name in the video as I normally do. So Heather, thank you so much for being our fabulous Frugal Family Patreon producer across our 3 channels. I really am grateful to you. I appreciate you so much. But this is what I'm able to do today. But at some point, probably when we're a little further along in the journey of this pelvic floor therapy, I really want to, look at all my vitamins over there. I haven't taken my vitamins yet. And I've got my sling right there. I need to put that on, my arm sling thing. Helps remind me to be careful with my elbow, you know. But anyway, once we get a little further along in the pelvic floor therapy journey, then I will do a more comprehensive video of what that's all about and what it entails, and the, you know, just, and then my thoughts on it and its efficacy and all of that, you know, and the, you know, costs and whatever. Anyway, something more comprehensive. But yeah, I am resting and relaxing today. We've got stuff going on tomorrow, so today just has to be resting. Stretching, yes. The exercises, yes. Like I said, this evening or this afternoon after I've had time to, you know, let, you know, ice and rest. And then go from there. I might try to do a bit of a walk today, but honestly, I'll consider myself successful if I just do the stretches and the exercises. So, good things are happening, but we are fighting pain with pain. But I do feel like it's worth it, and I'm grateful and I'm excited for some progress, you know? I am excited for some progress. We are still going through with the process to qualify for the nerve ablation. I have the test injections day after tomorrow, so Friday. And I'm a little nervous about those, but, you know, they're going to do 4 different spots in my spine, and I am nervous about them. And, you know, how much is it going to hurt? And then how much is it going to hurt after? And then is it going to help at all? And, you know, whatever. And am I even going to need the nerve ablation, you know? Because maybe this pelvic floor therapy will do the whole job. Maybe I won't need it, you know? But like I was saying in my journal, I think it was yesterday or the day before. I think it was the day before. I'm going to do it I'm going to go through this we've come this far in this process. I'm going to at least get the test injections. You do 2 rounds of them a week apart. And I'm going to go ahead and do them because why not? We've come this far, you know, and that even doing the test injections doesn't mean I'm locked in and have to do the nerve ablation, you know, and I am going to have probably at least 3 sessions with the pelvic floor therapist before we finish the 2 rounds of test injections. And so I feel pretty confident that I will know by then if the pelvic floor therapy is, you know, going to be enough to do the job without the nerve ablation. So, and that is my hope. That is absolutely my hope, to not have to do the nerve ablation, to be able to get through this and have enough improvement with the pelvic floor therapy that I don't need the nerve ablation. But I may as well get the test injections. You know what I mean? Does that make sense? So that is the plan. I'm going to be seeing the pelvic floor therapist once a week for 4 weeks. And then you go to like every 2 weeks, and hopefully no more than 10 sessions. Because what she said, like I said, she was very straightforward, which I do appreciate, is that we'll know by then if either it's helping and it's going to, you know, do what we need it to do, or if I'm going to need to be referred on for other treatment. So I am very confident that we won't need to be referred on. And even if we did need to be referred on, it's stuff that I'm already in the process of, like injections and the nerve ablation and stuff like, you know what I mean? But hopefully this will do it. This will do the job. I'm pretty confident about it. I feel pretty dang confident about it. But I'll let you know how the test injections go also, because if those provide immediate relief, which will be short-term, but immediate short-term relief with the injections, then, you know, I might be convinced that, hey, this might be a good idea. I don't know. Anyhow, that's all that's going on and what's coming up and all of that. But today is going to be a relaxed, lots of coffee, lots of kitty, oh, kitty, and lots of my favorite Halloween scary movies and stuff like that. That's what I'm doing today. What are you doing today? Besides watching this video, thank you so much. But tell me in the comments what you're up to and what's going on and all that kind of stuff. This has been my journal. I've been Julie. You have been marvelous, fantastic, and wonderful. I'll see you guys soon. I will try to journal tomorrow as well. Anyway.